Let me be honest with you right now. If you are waking up one, two, maybe even 3 or 4 times every single night just to use the bathroom, and you have been blaming your bladder this whole time, you are solving the wrong problem. And that is exactly why nothing has worked for you. What if I told you that in most cases, nighttime urination, what doctors call nocturia, has almost nothing to do with your bladder at all? What if the real cause is hiding somewhere else in your body, silently working against your sleep every single night, and not one person has told you about it? Stay with me, because the next few minutes might completely change the way you think about your sleep, your health, and your body. This is not a video about drinking less water before bed. This is something much deeper, much more important, and honestly, something most doctors never take the time to explain. Welcome. If this is your first time here, this channel is called Dr. Alex Morgan, Aging Wellness Lab, and everything we do here is built around one mission: helping you understand your body better as you age, so you can live stronger, sleep deeper, and feel more in control of your own health. If that sounds like something you need in your life, do yourself a favor right now and hit that subscribe button, and go ahead and like this video too, because we are just getting started, and I promise you, this one is going to be worth every minute. All right, let's get into this. So here is where most people start when they talk about waking up at night to pee. They think, okay, I must have a weak bladder. Or they think, I drank too much water after dinner. Or maybe they blame their age and just accept it as the way things are now. And look, I understand why people think that. It makes surface level sense. But here is what the science actually shows, and this is where it gets fascinating. The real driver behind nocturia in most adults, especially those over 40, is not a bladder problem. It is a hormonal problem, a cardiovascular problem, a fluid redistribution problem, and in many cases, a sleep architecture problem. All of these things together create the perfect storm that sends you sprinting to the bathroom at 2 in the morning, and then again at 4. And then you wake up exhausted, wondering why your body is betraying you. Let me walk you through this step by step, because once you understand the full picture, you are going to have a completely different relationship with this problem. The first thing you need to understand is a hormone called ADH, antidiuretic hormone. Some people also call it vasopressin. This is the hormone that your brain is supposed to release at night, and its entire job is to tell your kidneys to hold on to water while you sleep. In a young, healthy body, ADH spikes at night. Your kidneys respond by producing less urine. You sleep through the night without waking up. Simple, elegant, brilliant. But here is what happens as we age, and this is documented in multiple peer-reviewed studies. ADH production becomes less reliable. The rhythm gets disrupted. Your kidneys do not get the signal to slow down. So instead of producing concentrated, small amounts of urine while you sleep, your kidneys keep working at nearly full capacity, filling your bladder while you are trying to rest. And then your bladder sends the alarm, and you wake up. This is not your bladder's fault. Your bladder is just the messenger. The real problem is upstream, in your hormonal signaling system. Now here is where it gets even more interesting. And honestly, this part blew my mind when I first started digging into the research. There is a condition called nocturnal polyuria. And in clinical studies, this condition is found in somewhere between 60 and 80% of adults who regularly experience nocturia. Nocturnal polyuria simply means that your body is producing too much urine at night compared to the daytime, and the cause of this is not what you think. It is often related to fluid that has pooled in your lower body during the day, in your legs, your ankles, your feet, and then when you lie down at night, gravity is no longer fighting against your circulation. That fluid gets reabsorbed into your bloodstream, filtered by your kidneys, and turned into urine, all while you are trying to sleep. Think about that for a second. If you spend most of your day sitting, at a desk, in a car, on a couch, fluid accumulates in your lower extremities. That is just physics. And then, the moment you lay your body flat, your kidneys suddenly have a surge of fluid to deal with. They are not being lazy. They are actually doing their job perfectly. The problem is the timing. And the reason that timing is off is because of how you spent your day, not because of what you drank at night. This is why compression socks have actually been studied as a treatment for nocturia, not medication, not surgery. Compression socks, because they prevent fluid from pooling in the legs during the day, which means less fluid gets reabsorbed at night, which means your kidneys are not overwhelmed while you sleep. Studies out of Japan and Canada have shown measurable reductions in nighttime urination episodes just from wearing compression garments during the daytime hours. That is how powerful this fluid pooling mechanism is. Now let's talk about the cardiovascular connection, because this is where things get really important, especially if you are over 50. Your heart's job is to maintain proper circulation throughout your body. When your heart is working efficiently, blood moves well, fluid does not pool excessively, and your kidneys stay regulated. But when your heart is under stress, whether from early-stage heart failure, high blood pressure, or just the natural stiffening of arteries that comes with age, circulation becomes less efficient. Fluid backs up. It settles in the legs and lower body during the day. And then at night, lying down, all of that fluid comes rushing back to your kidneys, and your kidneys respond the only way they can, by making urine. This is one reason why nocturia can actually be an early warning sign of cardiovascular issues, and I say this not to scare you, but to empower you, because if you have been waking up multiple times a night for years, and nobody has ever connected that to your heart health or your circulation, that is a conversation you need to have with your doctor. Dr. Alex Morgan. Aging Wellness Lab is built on the idea that knowledge is protective. The more you understand your own body, the better equipped you are to advocate for yourself in a medical setting. Let's now talk about sleep apnea, because this is one of the most under-recognized causes of nocturia in the country. Studies suggest that somewhere around 50% of people with sleep apnea also experience frequent nighttime urination. And the connection is not obvious at first, but it is remarkably well established in the research. When you stop breathing repeatedly during the night, which is what happens in sleep apnea, your body interprets this as a kind of cardiac stress. Your heart actually stretches slightly in response to the pressure changes in your chest when you gasp or struggle to breathe. And when the heart stretches, it releases a hormone called atrial natriuretic peptide, or ANP. ANP signals the kidneys to excrete more fluid. More fluid means more urine. More urine means more trips to the bathroom. And you wake up thinking you have a bladder problem, when the entire chain of events started with your breathing stopping in your sleep. If you snore loudly, if you wake up feeling tired even after 8 hours, if your partner has ever told you that you stop breathing in your sleep, please take that seriously. A sleep study is one of the most valuable things you can do for your health, because treating sleep apnea can sometimes resolve nocturia almost completely, not partially, completely. People go from 4 bathroom trips a night to 0 just by starting CPAP therapy. That is how dramatically connected these two things are. Now, I want to spend some time on something that almost nobody talks about in these conversations: the role of blood sugar and insulin. If you have insulin resistance or early stage type 2 diabetes, or even just blood sugar levels that run high after meals, your kidneys are working overtime to filter excess glucose from your blood. And when your kidneys are filtering excess glucose, they pull water along with it to flush it out. This process, called osmotic diuresis, means your body is producing more urine even when you are not drinking more water. And this does not just happen during the day. If your blood sugar remains elevated into the evening and overnight, your kidneys are still working through the night, producing urine your body needs to get rid of. And you wake up. This is why one of the first clinical signs that something is going on with blood sugar regulation is increased urination, especially at night. If you have ever noticed that you seem to pee more after eating a heavy, carb-rich dinner, pay attention to that signal. Your body is telling you something, stabilizing your blood sugar through diet, reducing refined carbohydrates, eating earlier in the evening, choosing lower glycemic foods, can have a meaningful and measurable effect on how often you wake up at night. Let's also talk about medications, because this is a big one. A surprising number of common medications either increase urine production directly or cause fluid retention during the day that then gets released at night. Diuretics, blood pressure medications that make your kidneys remove excess fluid, are the obvious ones. But if you take a diuretic in the evening or even in the early afternoon, the peak effect might hit while you are asleep. Moving the timing of that medication under your doctor's supervision can sometimes reduce nighttime urination significantly. But there are also less obvious medications, certain antidepressants, calcium channel blockers, and some diabetes medications, that can contribute to nocturia as a side effect. If you started a new medication around the same time your nighttime bathroom trips increased, that connection is worth discussing with your physician. Now let's talk about what you can actually do about this, because this is where the conversation becomes actionable. And at Dr. Alex Morgan, Aging Wellness Lab, we never just leave you with the problem without talking about real solutions. The single most impactful lifestyle change for many people is something called fluid shifting, and it starts in the afternoon. If you reduce your fluid intake after about 6 in the evening, your kidneys have less raw material to work with during the night. But more importantly, if you elevate your legs for 30 to 60 minutes in the late afternoon, just lying back and putting your feet up above the level of your heart, you allow that pooled fluid in your lower body to be reabsorbed and processed by your kidneys before you go to bed, rather than after. You essentially front-load the work. Your bladder fills in the evening, you go to the bathroom before sleep, and then overnight, there is simply less fluid for your kidneys to process. Studies published in the Journal of the American Geriatrics Society have actually demonstrated that afternoon leg elevation combined with daytime compression stockings can reduce nighttime voiding episodes by a significant margin, without any medication. This is one of those simple, elegant, free interventions that can genuinely improve your quality of life. Movement during the day also matters. When you sit for long periods, fluid accumulates passively in your lower legs. Even short walks, 10 minutes every hour or two, can dramatically reduce how much fluid pools by the end of the day. Your calf muscles are sometimes called the second heart because of the way they pump blood back up toward your core when they contract. When you walk, those muscles squeeze fluid back into circulation, where it can be processed during the day instead of overnight. Salt intake is another important variable that does not get talked about enough in this context. Eating a high-sodium diet causes your body to retain water in order to maintain the right concentration of sodium in your blood. That retained water has to go somewhere, and often it settles in your tissues during the day and gets processed at night. Reducing sodium, especially in your evening meal, can reduce overall fluid retention and make a measurable difference in how your kidneys behave overnight. Let's talk about the bedroom environment for a moment. Temperature plays a role here that most people overlook. When your body is too warm during sleep, your blood vessels dilate, circulation increases, and kidney filtration can actually increase slightly as a result. Keeping your sleeping environment cool, somewhere around 65 to 68 degrees Fahrenheit, is the range most sleep researchers recommend. Not only improves your sleep depth and quality, but can also subtly reduce the overnight work your kidneys do. Everything in your body is connected, and optimizing your sleep environment is not just about comfort. It is about physiology. Now here is something I want to address directly, because I hear this from so many people in our community. Some people, when they start waking up less at night, feel almost anxious, like something is wrong because they are sleeping through. If you have been waking up to pee 3 or 4 times a night for years, that has become your body's learned rhythm. When you start addressing the root causes and your body no longer needs to wake up, your sleep architecture will shift. You may sleep deeper, you may dream more vividly, you may feel disoriented at first because it feels different. That is completely normal. Your brain is recalibrating. Give it time. I also want to speak to those of you who have tried restricting fluids at night and found that it did not help, or that it only helped a little. This is incredibly common. And the reason is exactly what we have been talking about this entire time. If your nocturia is driven by hormonal imbalance, sleep apnea, fluid redistribution, blood sugar fluctuation, or medication timing, then reducing your water intake is addressing the wrong variable. You may be mildly dehydrated and still waking up 3 times a night. That should tell you immediately that the fluid you are drinking is not the issue. The issue is what your body is doing with the fluid it already has. For anyone over the age of 60 who has been dealing with nocturia for years, I want to offer this perspective. You have not simply aged into a bladder problem. That is a story that too many people have accepted as inevitable, and it is simply not accurate. Yes, ADH production declines with age. Yes, bladder capacity can decrease. Yes, circulation becomes less efficient over time. But all of these things exist on a spectrum, and lifestyle interventions, proper diagnosis, and targeted treatment can meaningfully shift where you fall on that spectrum. Age is not a sentence. It is a context, and within that context, there is always room to optimize. There is also a psychological component to nocturia that rarely gets discussed in mainstream health content. Once someone has been waking up at night for months or years, the brain starts to anticipate it. You may begin waking up at certain times not because your bladder is actually full, but because your nervous system has learned to rouse you at those times. This is called conditioned arousal, and it is a form of learned wakefulness that can persist even after the physiological triggers have been addressed. If you notice that you wake up at almost exactly the same time every night, and when you get up the amount you urinate is actually quite small, conditioned arousal may be part of your picture. Working with a sleep specialist or a cognitive behavioral therapist trained in sleep medicine can help your brain unlearn this pattern. Let me also mention the relationship between stress, cortisol, and nighttime urination, because this is something the research supports clearly. Chronic stress keeps your cortisol levels elevated. Elevated cortisol disrupts your ADH secretion. Disrupted ADH means your kidneys produce more urine at night. Stress is not just a mental health issue. It is a hormonal and physiological one. If your stress levels are chronically high, your sleep is going to suffer in multiple ways, including nocturia. Meditation, deep breathing, evening routines that genuinely calm your nervous system. These are not soft suggestions. They are biochemically valid interventions with documented effects on hormonal balance. I want to take a moment to zoom out and give you the big picture, because sometimes when we focus on individual causes, we lose sight of how they interact. In most people who regularly wake up to use the bathroom at night, it is not one thing. It is a combination. Maybe it is mild sleep apnea plus fluid pooling from sitting all day, plus slightly elevated blood sugar from late-night eating, plus a diuretic taken too late in the day, plus age-related ADH decline. Each of these on its own might cause one trip to the bathroom. All of them together might cause 4. And conversely, addressing even 2 or 3 of them meaningfully might take you from 4 trips to 1, or from 1 trip to 0. The compounding nature of these causes means that even partial progress on multiple fronts can produce dramatic improvements in your sleep. At Dr. Alex Morgan, Aging Wellness Lab, this is the kind of systems-level thinking we try to bring to every topic we cover. Your body is not a collection of isolated parts. It is an integrated system, and when something goes wrong in one area, it creates ripples that affect everything else. Understanding those ripples is how you find real solutions. So let's do a quick summary of what you now know that most people do not. Nighttime urination is most commonly caused not by bladder weakness, but by hormonal disruption in ADH, fluid that has pooled in your legs during the day and gets reabsorbed when you lie down. Sleep apnea triggering a cascade of hormone responses that send urine production into overdrive. Blood sugar dysregulation causing osmotic diuresis. Medication timing that concentrates diuretic effects during sleep hours. And conditioned arousal that trains your brain to wake at the same time every night. And the solutions, in broad strokes, are elevating your legs in the afternoon to front-load fluid reabsorption, wearing compression garments during the day, walking regularly to keep your calf muscles pumping fluid back into circulation, reducing sodium especially at dinner, stabilizing blood sugar through diet and meal timing, reviewing your medications with your doctor for timing adjustments, getting screened for sleep apnea if you have not already, and addressing chronic stress through evidence-based techniques. None of this requires surgery. None of this requires accepting that your nights are just going to be fragmented for the rest of your life. But it does require understanding what is actually happening in your body, which is exactly what this channel is here to help you do. If this video helped you see your situation in a new light, I want to ask you to do 2 things. First, leave a comment below and tell me how many times you typically wake up at night and whether any of the causes I described today resonated with your experience. Your story might help someone else in this community feel less alone, and it genuinely helps me understand what topics to go deeper on in future videos. Second, share this video with someone in your life who needs it. You probably know at least one person, a parent, a spouse, a friend, who has been struggling with this and chalking it up to just getting older. Send this to them. It could change their sleep tonight. And if you want to stay connected with everything we are doing here at Dr. Alex Morgan, Aging Wellness Lab, hit that subscribe button and make sure your notifications are on so you never miss what we put out next. We cover everything from hormonal health and cardiovascular aging to sleep science and metabolic function, always with the goal of giving you real research-backed information that you can actually use. Thank you for spending this time with me today. Sleep well tonight. You now have every reason to.